Hi everyone, it's Dr. Samantha Benjamin Allen, board certified in physical medicine and rehabilitation, here to give you another post with tips for thriving as a paraplegic at home. This post is inspired by a paraplegic I just worked with and saw, who is actually recently injured, just less than 6 months ago. And I just want to first say to be encouraged and stay positive. Paraplegia does not mean you cannot do great things in life and still contribute to your family and society doing great things. You might have to do it a little differently, but there are amazing things that you can do even with paraplegia. So just want to say that first, okay? So 5 tips on what to do as a paraplegic so that you can thrive at home, okay? The first thing is daily mobility and stretching, okay? Even if you cannot move your lower extremities, it's important to mobilize them. So this involves either using a band, a stretchy band, or a towel, and draping it over your foot and bringing your knee towards your chest and lifting your leg straight up at the ankle so that you can encourage circulation and mobility, because stiffness leads to contractures, and that will actually serve as a detriment in preventing you from being able to walk if you have the potential to in the future. So that is one thing that is very important to do on a regular basis. The other thing is to make sure that you are doing strengthening exercises for your upper body. Now, a lot of paraplegics get upset when they're initially in therapy saying, why do they keep focusing on my arms? I need them to focus on my legs. But we want to make sure that you are doing the best with what you have to work with. And if your upper body is weak and it's not strong to take on the added work and effort of helping you to mobilize, you can injure your shoulder, your elbow, your wrist, and then if you don't have that, then you're really in trouble. So we want to make sure that we are strengthening your upper body and teaching you how to transfer and mobilize with what you do have so that you can still be safe and get around to do the things that you need to do while you are recovering. Now, for your lower body, it's also important to stretch on your stomach. So lay on your stomach for about 20 minutes a day just to stretch out those hip flexors, because if your hips are stuck in flexion, then it's going to inhibit your ability to stand upright with a straight posture. So you want to be able to stretch out those hip flexors and prevent contractures, okay? So one is your daily mobility and stretching routine, okay? And part of your mobility is pressure relief, okay? People who have spinal cord injuries are at risk, higher risk of getting pressure wounds, and pressure wounds can get infected and lead to bone infections and really be a hindrance to your recovery. So pressure relief needs to occur about every 2 hours, and that's basically leaning forward in your chair so you can get your bottom up off of the seat and put your hands under your bottom so that you are letting circulation happen in your bottom, or where you're dependent, so that that skin is getting the oxygen and the blood flow so that the skin doesn't break down and you don't get wounds. And in bed, that means turning every 2 hours. And this is major, so please do not neglect to do your pressure relief. Next thing is daily visualization exercises. This is part of your daily mobility routine. Visualization is a tool that helps in the recovery process. So even if the lower extremities are not moving, it doesn't mean you can't visualize and send signals from your brain down to the muscles where you desire movement, because it's part of the neuroplasticity process, okay? And it's no guarantee that it will happen or happen in the time that you want it, but it does not hurt to do it, and it works to your benefit. So basically, you close your eyes and visualize contracting your quads, lifting your leg, bending your knee, wiggling your toes, pushing your toes down, bringing them towards your nose, squeezing your butt cheeks. All of these muscles contribute to our walking ability. So it's important to visualize contracting those muscles even if they're not working, because it's part of the recovery process, okay? The next thing is social and community engagement. It's important to have good social support. We are not designed to be in isolation, and we need support. So involve yourself in a community. They have adaptive sports communities. So if you were an athletic person before this happened and you were wondering, what am I going to do? There are still tons of sports and athletic activities that you can get involved in. They have wheelchair rugby, there's wheelchair basketball, there's Paralympics. So get plugged in. And I'm going to leave a resource in the comments, places that you can look up in the DMV to get involved in that, okay? It's also important to stay socially engaged with your family. Recruit their support and let them know how you're feeling. This is scary, especially if it's in the beginning of the acute phase of this. Life is different, and sometimes we wonder, how are we going to move on with this? And it's important to get counseling if you feel like you're depressed or you are not functioning adequately to thrive because of the mental burden of what you're dealing with. Please don't think you're above therapy. It can help. And this is not a common thing that people go through. So people might say they understand, but they don't really understand. So you want to speak to a qualified professional if you're having struggles with that. And also seek educational advancement, opportunities to advance in your education. Some people, they move on to get their master's or another level of skill in whatever they're interested in. So that's certainly an option. And I've worked with many people who are doing amazing things in their careers despite paraplegia. President Roosevelt was paraplegic and he still led the country with paraplegia. So just remember, there's hope, okay? Next thing I want to talk to you about is medication management. You want to have an organized way to make sure that you're getting your medications, taking them on time, knowing your dosages. You can use a chart, you can use a pill organizer. I recommend people put a chart or poster on their wall in front of them that they can see easily and frequently to keep track of their daily activities that they need to do, okay? And you might be taking muscle relaxers or pain relievers in the process of your recovery, and you want to make sure that you are managing medications well. And if you need caregiver support to help you keep track of that, get a caregiver, okay? The next thing is bowel and bladder management, okay? UTIs tend to happen frequently if we are not doing a regular bladder program. So if you are a person who straight caths, you need to cath every 4 hours during waking hours to prevent UTIs. A probiotic and cranberry supplement can be helpful in managing your bowel and bladder to help evacuate those toxins and prevent bacteria from sticking to your urinary tract and causing infections. The next thing is eating a well-balanced diet. You want to make sure you're getting enough protein. Every day you should have 2 to 3 servings of fruits, vegetables, whole grains, legumes, meaning beans, and nuts, a handful of nuts if you're not allergic. That needs to be a part of your daily intake so you can have a balanced diet. So 2 to 3 servings of each of those things. And also, constipation is an issue for many people who struggle with paraplegia. Not everyone needs a bowel program where they use an enema or suppository. Some injuries are not complete, so some people still have some function of bowel and bladder. And those who don't need to use a suppository or have a bowel program where they're going every day or every other day at least, okay? And stool softeners can also help, and laxatives. And you want to do that under the direction of your physician. So those are some tips I just want to leave with you, and I'm going to have some resources in the comments to help you along your journey. And if you are someone who's struggling with paraplegia at home and you desire to achieve increased mobility, function, independence, and quality of life, book an appointment for a consult with Freedom Wellness Physiatry. A physical medicine and rehab specialist physician will come directly to your home to develop a treatment plan to help you achieve your goals and partner with your caregiver to help you along your journey to living better. You can do this, so I want you to be encouraged and know that you're not alone, and you can continue to get better and learn new things and do great things in spite of this, okay? Now, more details will be in the comments because I don't want to make the video too long, but I think I touched on the things that I wanted to discuss. And yeah, see you next time. Freedom Wellness Physiatry is at www.freedomwellnessphysiatry.com. Physiatry is spelled P-H-Y-S-I-A-T-R-Y. Or you can call us at 240-339-5377. Thank you. Have a great day.